Hello, my name is Annika Vestergaard Kvist, and I'm doing a PhD at the University of Southern Denmark about the real-world evaluation of causes and causes of fractures in patients with diabetes. And this is a part of the FIDELIO consortium. Type 1 diabetes and type 2 diabetes are chronic diseases defined by increased blood sugar. In common, they have an increased risk of having fractures, which is affected by the risk of falling and their bone health. Patients with diabetes might have impaired fracture healing, increased risk of complications after fractures, and also an increased risk of passing away after fractures. I have 3 projects. In the first one, we look at incidence rates of fractures over time among patients with type 1 diabetes, type 2 diabetes, and patients without diabetes. In the second project, we look at the cost of fractures within patients with type 1 and type 2 diabetes compared to patients without diabetes. And in the third project, we try to find any patterns in the causes of fractures among patients with type 1 diabetes and type 2 diabetes. The data I use is hospital records for patients in Denmark. Within this data, I have the diagnosis given to the patients, the prescription medication, I have surgeries and procedures done, visits to clinics, all the healthcare costs. I can see the highest level of education, I can see the date if they pass away, and I can also see their yearly income. In my first project, with the trends over time, I calculate incidence rates per 10,000 persons years to make sure that it's comparable between the groups. For the cost of fractures, which is the next project, this is a cost of illness study where I look at the societal perspective and includes the costs of fractures. The third project will be pattern recognition of comorbidities and medications, where I'll be applying machine learning to the data. The reason for doing these studies is that we hope to be able to individualize the treatment of patients with type 1 and type 2 diabetes in order to decrease their fracture risk. Thank you for your attention.